For the past 3 weeks, Rwanda has been battling a rare Marburg virus outbreak, straining the country's healthcare system. Since the outbreak was reported on 27th September, 62 cases have been confirmed with 15 deaths and 45 recoveries recorded. 3 patients are still being treated. Cases were first reported in several major hospitals in the capital, Kigali, with many of those infected being healthcare workers. However, there is now hope. During a joint press briefing on Sunday, Rwanda's Minister of Health, Dr. Sabin Nsanzimana, announced a 92% drop in new infections in the third week, with no new cases reported in the last 6 days, signaling the outbreak could soon be under control.
But we start to see a significant trend towards the week 3, where a 50% reduction was observed, which is the best indicator. You can see that an outbreak is dying when you start to see that 50% decline between week 1 and week 2. So we saw that at week 3, which brought a lot of hope that this is going to be contained quickly.
The World Health Organization Director General, Dr. Tedros Adhanom Ghebreyesus, arrived in Rwanda on Friday, October 18th, to assess the ongoing Marburg response and reaffirm WHO's support. The next day, health authorities announced that 2 Marburg patients had been successfully taken off mechanical ventilation after 10 days of care at the National Marburg Treatment Center in Kigali. Tedros called it a breakthrough that would enhance clinical management guidelines for viral viruses.
2 of the patients we met had experienced all of the symptoms of Marburg, including multiple organ failure, but they were put on life support. They were successfully intubated and extubated and are now recovering. We believe this is the first time patients with Marburg virus have been extubated in Africa.
Since the first Marburg virus disease case was confirmed in Rwanda, the WHO deployed a team of experts to assist in training local healthcare workers. The global healthcare body has also provided medical supplies to Rwanda to help control the outbreak. Data from the Rwanda Health Ministry show that 1,070 doses of vaccine have been administered as of October 19th.
The increasing frequency of outbreaks, true, and that shows our vulnerability, by the way, and we still are not prepared. But now I think maybe we're changing the tide because of the COVID lessons, that we are doing more, starting from, for instance, the pandemic agreement.
Rwanda's health minister, Dr. Sabe, says that the first Marburg case may have originated from a 27-year-old male who was likely exposed to the virus through an infected bat in a cave, confirming a zoonotic transmission. The World Health Organization Director General has warned that restricting travel to Rwanda during this period is unnecessary, and he has urged the international community to avoid imposing such measures. Rwanda's health minister revealed during the press conference here that they do not plan to vaccinate or provide antivirals to everyone. These measures are prioritized to those at high risk, including healthcare workers who are exposed to the virus through treatment of patients. Ethan Tashebia for CGTN, Kigali, Rwanda.